Hi there, Nhlanhla, you're right. In fact, we are in Umtata in Kweze Extension, where Kopano meet, and it's a hangout spot, essentially, where people at the weekends would come and have a good time. As you know that, restaurants and other places where people can come out and dine are now allowed to operate under level 2 of the national lockdown. So what we're currently seeing here, we're seeing health authorities in the Eastern Cape, in fact, taking their campaigns to areas like this. The focus here in Nhlanhla is on men. They want to encourage men to take the jab. If you look into the numbers in Nhlanhla, here in the Eastern Cape, they've been able at least to vaccinate 1 million people. Those people, Nhlanhla, are fully vaccinated. But here's the problem. They're saying that out of that number, less than 40% of them are men. That's why now there's this campaign that's targeted at men. I want to bring in the health MEC of this province, Nomakhosazana Meth. MEC, thank you so much for your time. I mean, let's talk about this campaign. You're saying no vax, no beer. What's that all about?
Good afternoon, Malungelo and viewers at home. We are here to find our men because we are concerned by the fact that of the 1 million fully vaccinated and 1.4 million vaccinated, some partially vaccinated because of the 2 jabs, 38% is men and 62% is females. And there is this myth that if a man vaccinates, there is going to be importance, there will be no children born, there will be sickness, people will die within two years. So I want to interact with them, talk to them, tell them why it is important that them as men, they must also come forward and vaccinate. Because men are very mobile, they are good at networking, they are socializing people. So they may be spreaders of this COVID-19 if they are not vaccinated. So we are coming here to talk to them, vaccinate those who are able to vaccinate, or vaccinate those who are able to vaccinate, and register those that are not ready today so that we can make a follow-up to vaccinate them.
Do you think, MEC, there could also be a problem about information? Because one of the things that one of the gentlemen that I was speaking to was that there's lack of information about all of this.
Yes, we understand people are very busy. Maybe the communication that we're doing is not enough. That's the reason why I want to partner with you, media, to interact with our people more, to even bring those that are hesitant to vaccinate, to tell their story, what is it that they are worried about, and also make those who have vaccinated share their experience, including their spouses or fiancés. I want to open up a platform where we'll get from both those who are hesitant and those who have vaccinated so that they can tell the story, the fact, not the myth, to say I've vaccinated instead. My wife or my girlfriend is happier after I've vaccinated because there's this issue of importance, which we know it's not true, it is a myth. So there is that issue of myth, there's issue of information, there's issue of even ignorance sometimes because people don't know where to get the vaccination sites. Hence we've decided that Eastern Cape, on top of the 1.2 vaccination sites, we must do pop-up sites. We do drive-thrus, we go to the sports facilities, sports field, to interact with the professional clubs and all that so that we access or we get the men so that they can access the vaccination.
I mean, how have they received you here? I saw people were laughing and all of that. How did they receive you?
Actually, the reception was amazing. It was very warm, starting from the owner. And the owner, when I got here, the team of nurses that you are seeing behind me were busy at work already, having vaccinated quite a number of people. They interacted with the employees of this Kopano area where it's dry and people are having their drinks. So the owner took me to go and greet the patrons. The welcome was very warm. Actually, I sat down with them. I also even had some piece of meat and we were sharing these things, talking. Because we want this thing not to be that tense. It's not that tense. We must just discuss these issues in a relaxed environment.
Were there any questions, MEC, that were asked to you and you were happy to respond to those questions? Serious
questions that I've been hearing that they are asked, but unfortunately I had not had an opportunity to have that opportunity to hear people ask those questions. They are asking me about the issues of importance, and I explained to them that this thing is scientifically proven, that it is safe to administer, does not have such side effects. This is just a myth. They're talking about these issues of not bearing children and people saying that you will die if you vaccinate. So they were frank to me, open, and they welcomed all my explanations.
No vaccine, no sex?
Yes, what I'm saying, if the majority of those who are vaccinated in our province is females, and males are not coming to vaccinate, they are a danger to us. The reality is, it's not like before when there was no COVID, when you were happy to meet with your boyfriend, with your spouse, anytime, anywhere, even if it's a distant affair, because we're not worried about what is going on. But now people must be sure that they are safe. The fact that you have a partner, the fact that you will have sex, that must not be your road to death. You must be sure that you are safe, because if we talk the truth, meeting people and coming that close and doing what you know is done by lovers without being sure if this person is vaccinated is dangerous and is a risk. So I am just saying it's an advice from me to the women to say, let's make sure that our partners also, they vaccinate. Otherwise, it's a risk of losing their lives and of losing them and also infecting other people.
So you're not saying that if a female has a partner who's not vaccinated, they shouldn't have sex?
No, I'm just saying they must make sure that their people are vaccinated. If it goes to the push of saying, because you stay away from where I stay, I want to see if you are vaccinated. This issue of the certificate, vaccination certificate, can start at home from the lovers to say, before we do this thing, can you show me that you are vaccinated? Because all of us at the end of the day, we want to be safe.
MEC, in terms of the herd immunity, at what point, though, are you hoping that you'll reach herd immunity? In the province, we've got a population of over 6 million, right? So at what point are you hoping to reach herd immunity?
Initially, we've put ourselves a target of by March 2022, which we are still keeping on to that target, even though we know there's been glitches here and there in terms of the availability of vaccine, but we are still pushing very hard. We are targeting by the end of this calendar year that we must have reached 2 million of people who are vaccinated, so that at least by the end of 2021-2022 financial year, which is March 2022, we should have been nearer or closer or have reached our target of 4.5 million. So we are still putting that target. Hence, we don't have a weekend. We don't have even at night with the Transvaco. We're even having outreaches teams that are going to the industries where they are working at night. So we are not sleeping, pushing to reach our targets.
All right, MEC for Health here in the Eastern Cape Nomakhosazana Meth. Thank you so much for your time. All right, I'm going to see if I can speak to some of the patrons. So I'm going to give Gidumezi a chance to be able to remove the camera off this tripod, and then we'll go to some of the patrons and see what is it that we'll get from them. Sonhlanhla, please stay with me. Stay with me. Okay, so we just want to speak to one or two of your patrons who are willing to talk to us, okay?
Yeah,
is there somebody willing to talk to us?
Yeah.
How you say? You're live on Newzroom Afrika. Thank you so much for your time. What's your name, sir?
I'm speaking to Neo.
Neo.
Yes.
So today they're here, they're talking about a vaccination of targeting men. Why do you think that men are not taking the COVID-19 jab?
Actually, men, it's in their nature, actually. You know the stigma of men trying to do things later, on a later stage. Women will be there first and do everything else. Yeah. I think we've got that problem in South Africa, that we need to change the mindset in terms of men thinking that things has to be done by females first, then they can do them later, such as everything else. But in an overall to that, I think one of the things that is becoming a problem here in South Africa about the actual vaccination is what is being said, things that it will do, it will make men not to be men enough if they take the vaccine and also forth, which is it's just a myth. Those things are not true. Men need to stand up and protect their families and be the men they say they are.
Would you then agree with this no sex, no vaccine, no sex idea?
I would agree with that, especially on a health-wise perspective. If you're vaccinated, it says no sex, then it has to be no sex.
If you're vaccinated and your partner has not been vaccinated, Neo says it's okay not to have sex. I want to see if there's someone else who would want to talk to me. Gentlemen, how are you? You know, when you shake your head, you're making me want to talk to you. But then what do you think forces men not to take the jab? Hello, you like the Newzroom Afrika?
Yo. No, I'm vaccinated. I don't know why they don't want to come and take the jab. Yeah. I don't want to speak on their behalf.
Yeah.
I've done it. All I can say, they must come and do it.
And it's safe. You feel safe and comfortable?
Certainly, yes. Yes, it's safe. There's no side effects or no what. They must come and do it.
They must come and do it.
Yes.
Okay, I'm also fully vaccinated, and the MEC will be happy to hear that. He as well is fully vaccinated. All right, Nhlanhla, I don't know if you still want me to talk to more people.
Well, that's a very interesting perspective being given by men this time, Malungelo, about their insights when it comes to myths and their own hesitation around vaccines. But also important to note there was that the MEC had also made a pledge saying that they are targeting to have about 4.5 million people vaccinated by April next year. Speak to us quickly about that, Malungelo.
That's right. In fact, Nomakhosazana Meth is still with me. And one of the things about the Eastern Cape, as you'd know, is actually a very rural province, and it's quite remote. MEC, let's talk then about, if you want to achieve that herd immunity, considering the fact that the Eastern Cape is very rural and very remote, how then would you make sure that, vaccines get to every person in this province?
Okay. Our first approach was to make sure that all our primary healthcare facilities, that is clinics, district hospitals and big hospitals, are vaccination sites. And we added on that the church halls, working with the church leadership, and added the community halls. We are in malls all over, big and small malls, in small and big towns. We are having partnership with the sports fraternity in terms of the cricket, the SAFA. We are working with them. We are going to stadiums. We are going to sports fields. We are here now with the business people, hospitality sector. We are working with them. So our approach is multi-pronged because we want not to make our people pay for them to access these services. Hence we are taking them to where people are, in particular in the rural areas. We are going to the queues, the SASA pay points, targeting the 60 years and above. Hence now they are the leading in terms of the numbers. The 60 years and above are almost more than 62% now of those who have vaccinated. It is because we have taken the service to the people because we knew it's not going to be easy for them to come to the service.
I must say, MEC, yesterday I was in Ngavungavu in Libode. It's one of the rural villages, deep rural villages here. And I was interacting with about 6 people. And I can say that all of those 6 people that I was interacting with actually said to me that they're fully vaccinated.
Yes, that's the point. Our people are welcoming this program. And even when we take the pop-ups to the rural areas, they come in numbers. We are just appreciating that support and the turnout from our people in the rural areas.
What has been the role, MEC, quickly, of the traditional leaders in the drive, for vaccination?
Actually, they are one of our influencers, our very important people who have come into party, who are supporting us. Hence, I'm talking about community halls. We're even going to the traditional councils, those authorities where our people go to discuss the issues of the communities. So we are partnering with kings, with chiefs, with his bond and everybody. So the support is overwhelmingly good.
All right, that's Nomakhosazana Meth. She's the